Welcome back to Ironwood Cancer Insights. My name is Kayla, and I'm your host with Ironwood Cancer and Research Centers. And July is Bone and Sarcoma Cancer Awareness Month, and we have a special guest, Dr. Syed Akbar.
Hello.
Thank you for being here today.
Thanks for having me here, Kayla.
And today we're going to cover the topic of Sarcoma and Bone Cancer Awareness Month. So to get started, could you just kind of explain what a sarcoma is?
So a sarcoma is a general term that is broadly used for cancers that arise in bones and soft tissues. Commonly, sarcomas start in the bones, and with this being a bone cancer awareness month, we can focus more on that part and see, how that presents and, take it from there.
So when looking at a sarcoma that is mostly focused on bone cancer, can you talk about some frequently symptoms?
Yeah, so typically bone sarcomas would present as pain at the site of where the cancer starts. So any kind of persistent pain in the bones is something that you should get evaluated for. Sometimes the cancer can eat away at the bone and result in a fracture at that bone site. So that is another way sometimes patients can present as well. So I would say pain is the predominant symptom that we typically see with new sarcoma patients.
Awesome. So when it comes to a pain, is it more of like an aching pain that most people feel?
Yeah, it could be. It could vary. It could be from a dull aching pain to a sudden sharp pain if a fracture happens as a result of sarcoma. So what I would say is anything that is persistent, for which you don't have an explanation, something that you should get further evaluated through your physician.
Can you also touch base on when sarcoma cancer presents and what are the characteristics of it?
So absolutely. So typically bone sarcomas have what we call as a bimodal distribution, meaning there are two age groups where we see more incidence of bone sarcomas. It is present in a younger age, in adolescents and young adults. The risk of sarcoma is high, and then also in our older population, people above 60 with peak around age 65 is where the incidence of sarcoma is more, certainly.
So with those two age groups, are there risk factors that present themselves in these patients?
Absolutely. So there are certain risk factors we take into account for bone sarcomas. Certainly prior exposure to radiation or chemotherapy is a risk factor for developing sarcomas. There are certain benign bone conditions like Paget's disease that can eventually transform into sarcoma, and then there are certain genetic risk factors that if you have a certain syndrome, some of which can lead to you having increased risk of developing sarcomas.
So as far as symptoms go and getting diagnosed, you had touched on making sure that you're seeing your primary care physician if you're having pain. What does a diagnostic workup or the tests involved with this type of sarcoma getting diagnosed look like?
Yes, certainly. So typically the first step for something like this would be getting an x-ray of that bone. A lot of times an x-ray can give us a good idea of what's going on, and if there's something abnormal we see on the x-ray, that would typically lead to an orthopedic referral, where an orthopedic doctor will, looking at the x-ray, either consider doing a biopsy, or sometimes they perform a more sensitive scan like an MRI of the bone to get a better picture. Eventually, biopsy of that area of concern is what leads to confirming the diagnosis of sarcoma, which ideally should be done by an orthopedic surgeon, since it also helps them plan out their eventual surgery down the line.
So then, after they're seeing an orthopedic surgeon, when would a medical oncologist get involved?
So, depending on the type of sarcomas, there are some sarcomas where the role of chemotherapy is more important. So, once the sarcoma is diagnosed, typically medical oncology get involved from the get-go, where we can help them determine whether adding chemotherapy before surgery would provide any benefit or not. Or sometimes we will end up seeing patients after they have completed surgery, and then we can assess whether any additional treatments like chemotherapy will lower the risk of the cancer coming back. But ideally speaking, the earlier we get involved, the better.
So when it comes to treatment after you are diagnosed with a sarcoma, what does treatment kind of look like for a patient?
So the treatment depends on the type of sarcoma, of course, as well as the extent of the disease, meaning what the stage of sarcoma is at that point. Mostly sarcomas are localized, meaning they stay within the bone and they tend not to spread to other organs. And if that is the case, then treatment generally involves a multidisciplinary approach where we involve the orthopedic surgeon, we have a medical oncologist, as well as a radiation oncologist. And then together, depending on the type and of the stage, we decide on a treatment plan. Mostly sarcomas are surgically managed, meaning we try our best to cut it out. If possible, sometimes that involves doing some systemic treatments like chemotherapy before surgery to shrink it down, to allow the surgeon to get better results and potentially spare limb, because that is one big concern with sarcoma surgery is the risk of amputation. And if with treatments we can avoid that, we always look into it. In more advanced sarcomas which have spread to other areas, which is not a common finding, but in that case, it's typically we rely on systemic treatments, which is a combination of chemotherapy drugs. And of course, we always look at clinical trials to help determine if there are any newer treatments available to deal with it in a better way.
So it sounds like patients have options when it comes to a sarcoma. So you kind of touched on, with the multidisciplinary approach, radiation. Can you go into a deeper dive of radiation treatment in this type of cancer?
Absolutely. So radiation is something we always consider when the surgery is done and the surgery was incomplete, meaning the cancer was not all removed. So that is certainly one situation where the role of radiation becomes very important. It is also has a very important role in patients who, for whatever reason, cannot go through surgery. So radiation in that case also provides local control and allow us to shrink down the tumor and get a control over their symptoms. So very important part of the treatment options for our sarcoma patients.
When it comes to sarcomas, we talked a little bit on treatment with radiation. Are there any new type of treatments out there for sarcomas?
Yes. So historically, the outcomes with sarcoma was primarily driven by surgery and different surgical approaches, but over the last 30 years, with the advent of new chemotherapy combination regimens that we have available, the outcomes have definitely improved a lot, where people have better control, they tend to live longer, and the surgical outcomes are also much better in cases where we utilize chemotherapy before surgery as well as chemotherapy after completion of surgery. So definitely we are seeing things move in the right direction. And of course, with the clinical trial, we're always looking to optimize and improve what we have. So we always consider enrolling patients in clinical trials whenever we feel like they're eligible to be enrolled in one.
Well, it sounds like things are moving in the right direction as far as cancer is concerned with sarcomas. Thank you, Dr. Akbar, for being here today.
Thank you for having me here, Kayla.
So July is Sarcoma and Bone Cancer Awareness Month, so if you're looking for more information on that or Dr. Akbar, you can head to our website, ironwoodcrc.com.